Join us as we explore Parkinson's and related conditions with movement disorder neurologist Dr. Jonathan Isaacson. He breaks down the key features that define Parkinsonism, how different diseases are distinguished, and the advances improving early diagnosis and care.
Parkinsonism is a term that describes kind of the syndromic nature of these diseases that have similar features of Parkinson's disease and sister conditions that are very similar. It was historically used as a term to describe the symptoms that patients may have before we were able to have more precision methods of determining which type of Parkinsonism they have. Parkinson's disease describes 4 cardinal symptoms that we typically see in our patients, including bradykinesia or slowness in movement, a rest tremor, where you see a tremor when you're at rest or when you're walking, rigidity or stiffness in the extremities or in the arms and then in the legs, and postural instabilities. And a combination of these symptoms would be diagnostic of Parkinson's disease. So Parkinson's disease tends to be the highest prevalence that we see in the general population, but there's other diseases that behave very similar to Parkinson's disease. We sometimes signify these with red flags or different symptoms that we see in these other conditions that we don't see as often in Parkinson's disease. But some things we see in Lewy body more so than in Parkinson's is early cognitive features and early hallucinations, where in Parkinson's we sometimes see it more down the line in the disease process. In diseases like multiple systems atrophy, we see symptoms like orthostatic hypotension or other autonomic symptoms, and also cerebellar symptoms as well. In supranuclear palsy, we see a lot of difficulty with vertical gaze, and then also recurrent falls as well can be some signs of that disease process. And then some of the other ones that are more rare are cortical basal degeneration, where it tends to have a much more asymmetric presentation, where one side of the body tends to have much more profound symptoms, such as significant tightening or something called dystonia of one side of the body. Or sometimes the hand will do things that we're not cognitively aware of, called alien hand phenomenon. So those are some of the ways we can start to differentiate these diseases.
1817 Parkinson's disease was described by James Parkinson, and it took over 150 years before we had the first symptomatic medication for Parkinson's disease. And in the last 30 years, we've had over 30 different medications to treat the symptoms of Parkinson's disease. And so nowadays we can really treat Parkinson's disease very well, and most people will live their entire life with Parkinson's disease as a chronic condition, but most people won't die because of Parkinson's, but because of other conditions that may accumulate. We have better diagnostic accuracy and better diagnosing these conditions, being able to have the right diagnosis for each individual patient. These different approaches where we're able to target different specific types of Parkinson's disease and these different specific types of Parkinsonism is one of the most exciting parts of the disease course now, because we're looking at slowing down the disease, not just treating the symptoms of the disease. And outside of that, having higher diagnostic accuracy, we're better able to pick up these conditions even in the prodromal period or before even the motor manifestation. And the goal is, if we can attack these conditions early or even before the manifestation of motor symptoms or cognitive symptoms that we see with all these different types of conditions, the goal would be to slow down these conditions or even halt these conditions in its track. So I think there's a lot of exciting elements to both Parkinson's disease and other neurodegenerative conditions.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.